didn't believe that I had it as bad as it seemed.
I wasn't surprised. Didn't want to particularly hear it, but was glad there was a reason for why I'd been struggling so much at work.
I don't think it worried me, because I think I felt perfectly okay.
Welcome to the Dementia Guide. This guide is for anyone who has recently been told they have dementia. It will also be useful to close family members and friends, as it includes information for people who might be starting to take on a role as a carer. You will find information to help you understand more about dementia, as well as some practical things you can do to live well now and make plans for the future. Being told that you have dementia can make you feel a range of emotions. The news might come as a shock, or for some people, it might bring a sense of relief, as it provides an explanation for the problems they've been having. It can also have a big impact on family and friends. My family and I have personally been affected by dementia, with both my granddad and aunt being diagnosed. I understand some of the difficulties and challenges people face in coming to terms with the diagnosis and figuring out how to make adjustments to everyday life and access support. My family have taken great comfort in the information and support they've received, which has really helped to make the best choices for their care. It is important to know that you aren't alone. About 800,000 people in the UK have dementia. It is possible to live well with dementia, and there is support available for you and your family. If you can, talk to friends and family about how you're feeling. Other people need to understand what you're going through. They might be finding things hard too, so talking to them can help both you and them. There are also specialist health and social care professionals you can talk to for support. You'll find information about Alzheimer Society services later on in this guide. Alternatively, you can phone our National Dementia Helpline on 0300 222 1122. Please take your time watching the various sections of this guide. You'll hear from a range of people, including health and social care professionals, and people who are living with dementia and their close family. It is possible to live well with dementia, and you don't have to face it alone.
We're a strong couple together, and we're very sort of positive in everything we try to do. We were absolutely devastated.
For me it was a relief really, because I felt once he was diagnosed it was just good to know that there was a reason for it. I don't think he found it so much of a relief, because I don't think he really believed there was much wrong with his memory.
A lot of people say, what's the point of having a diagnosis if there's no cure? And it does make you wonder, but for me, yes, I'm glad I got the diagnosis. At least with the diagnosis you can try and make plans for what you're going to do for the next however long you've got.
Dementia is an overall term for a range of conditions. It isn't just one specific disease. Most people have heard of Alzheimer's disease, which is just one type of dementia. Despite what many people think, dementia is not a normal part of ageing. Dementia occurs when the brain is affected by a disease. Dementia affects everyone differently and can cause a wide range of symptoms. These can include problems with memory, thinking, concentration, and language. People may become confused or struggle with how they see things. Dementia can also cause changes in mood or emotions and affect how someone behaves. Unfortunately, dementia is progressive and symptoms will get worse over time. There are over 100 types of dementia. The most common are Alzheimer's disease and vascular dementia. Sometimes people have a combination of both, which is called mixed dementia. Less common types of dementia are dementia with Lewy bodies and frontotemporal dementia. At the moment, scientists don't know why some people get dementia. It's known that ageing, genes, health and lifestyle all play a part. There are 800,000 people living with dementia in the UK. The chance of developing it increases rapidly with age. 1 in 14 people over 65 years of age and 1 in 6 people over 80 has dementia. So most people with dementia are older, but dementia does also affect younger people of working age. People who are diagnosed with dementia who are under 65 are said to have early onset or young onset dementia.
Well, I can remember it quite distinctly because Hilary came home and I could see in her face there was something wrong. And I said to her, "What's wrong?" And she said, "I might as well tell you, I've got Alzheimer's."
Looking back, I can go back 15 years and see things starting to change, but not to a level where it bothered me. The key thing that made me go back to the doctor when I got the diagnosis last year was I'd had a meeting, a pretty intensive meeting. It was a one-to-one meeting with somebody I hadn't met before. Then a few weeks later I was at a conference and this person came up to me and said, "Hello Hilary, how are you?" And I would have sworn I had never met that person before. I just didn't recognise him, but that freaked me out a fair bit, having sat opposite somebody for 2 hours, having an intense conversation with them and then not recognising them just a couple of weeks later. That was what finally prompted me to go back last year. And as a result of the tests and the brain scan, I got the diagnosis of early onset Alzheimer's.
To find out more about dementia, visit alzheimers.org.uk/about-dementia.
You can live your life with the treatment you get. I suppose the drugs that they give us are obviously doing us good. And I know I'm taking medicine, but I just don't think about it. I think it must be helpful because I really don't have too many worries about it.
There is currently no known cure for dementia, although there is lots of research going on to find one. However, there are drugs that will help to treat some of the symptoms of dementia or stop them progressing for a while. This depends on what type of dementia someone has. People who have Alzheimer's disease or mixed dementia, where Alzheimer's is the main cause, are usually offered one of 4 drugs: donepezil, rivastigmine, galantamine or memantine. These are widely known by the brand names Aricept, Exelon, Remonil and Ebixa, but there are others. These drugs all help to tackle the physical changes in the brain that cause dementia. The first 3, donepezil, rivastigmine and galantamine, are usually prescribed to people who have mild to moderate Alzheimer's disease or mixed dementia. Some people find these drugs lessen their symptoms for a while. Benefits can include improvements in motivation, anxiety levels, confidence, daily living, memory and thinking. These drugs will initially be prescribed by a specialist, such as a consultant at the memory clinic. If one of these 3 drugs causes problematic side effects, it is possible to switch and try one of the others. People who have moderate Alzheimer's disease but can't take any of the 3 drugs we've just talked about, perhaps because of side effects, might be offered memantine, known as the brand name Ebixa. It's also become more common to be offered memantine in the later stages of Alzheimer's disease when symptoms become severe. The benefits of memantine are that it can temporarily slow down the progression of symptoms in people in the middle and later stages of Alzheimer's disease. It may also help with agitation or aggressive behaviour, which are more common in more advanced dementia. The last 4 drugs I've just described that are used for Alzheimer's disease aren't effective for people with vascular dementia. They're only given to people with vascular dementia when this is part of a mixed dementia with Alzheimer's disease. It may be possible to slow down the progression of vascular dementia by taking drugs that treat the underlying conditions. So the GP will often prescribe drugs for people with vascular dementia who are at risk of having a stroke, or who have high blood pressure, high cholesterol, diabetes or heart problems. In many cases, the person will already be taking some of these medicines. If they are experiencing distressing symptoms such as hallucinations, which is where people see things that aren't there, or delusions, which is when they believe things that aren't true, someone with dementia with Lewy bodies might benefit from one of the 3 anti-Alzheimer's drugs, donepezil, rivastigmine or galantamine. In frontotemporal dementia, the anti-Alzheimer's drugs haven't been shown to offer any benefits and may even be harmful. Because of this, they shouldn't be prescribed. It's common for people with behavioural variant frontotemporal dementia to be prescribed antidepressant medication. This can help to reduce some of the inappropriate, obsessive or compulsive behaviours that are common symptoms of frontotemporal dementia. As with lots of medication, drugs to treat dementia can cause some side effects. For example, donepezil can cause nausea or diarrhoea. For more information on side effects, talk to your GP. Drugs are not the only way to treat or manage the symptoms of dementia. There are many other things that can help people to live well. Talking therapies such as counselling or psychotherapy give people a chance to speak in confidence to a qualified professional about problems or issues that might be bothering them. They might help you to come to terms with the diagnosis and identify ways to live well with dementia. They may also help with symptoms of depression or anxiety. Talking therapies typically involve regular sessions with a therapist, either one-to-one or sometimes in a group. They can be face-to-face or over the phone. Some people will just have one session, while the others will have therapy that continues for many months. Alongside talking therapies, there are other non-drug approaches that may be helpful as dementia progresses. Some of the more commonly used ones are reminiscence therapy and life story work, and cognitive stimulation therapy. Reminiscence work involves talking about things from the past, using prompts such as photos, familiar objects or music. It can be one-to-one or in a group. Life story work is usually shared between the person with dementia and a family member, friend or support worker. A scrapbook or photo album is used to record details of the person's life. These techniques, particularly when done one-on-one, can improve mood, well-being and some mental or cognitive abilities such as memory. At the same time, they can help others to focus on the person rather than their dementia. The services available and how to be referred to one of them can vary around the country. Ask your GP, memory service or local Alzheimer's Society for details of what is available in your local area. Another non-drug option for people with dementia is complementary therapy. These therapies are outside of conventional medicine and are used to treat or prevent illness and promote health and well-being. Complementary therapy should be used alongside and not instead of conventional medicines. Anyone thinking about trying these therapies should tell their GP. Some examples of therapies that may help people with dementia are massage, aromatherapy, bright light therapy, where you sit in front of a light box, and music therapy.
I think I worry more about how Rusty's feeling, in as much as he gets a bit depressed with himself. I think that's probably my biggest worry. I think the fact that he worries about he can't do things like he used to, like he gets in a muddle if he tries to change plugs and can't get the television to work and things that he's always been able to do, so he gets a bit depressed about that side of it.
It's quite common for people with dementia to experience depression or anxiety, especially in the early stages. People who have vascular dementia or Parkinson's disease dementia are more likely to experience it than people with other types of dementia. There are both drug and non-drug treatments that can be used for depression and anxiety. Antidepressants work by correcting the level of some chemicals in the brain. But research has shown that common antidepressants don't work as well for depression in people with dementia as they do for people that don't have dementia. It can take several weeks to notice the benefits of taking an antidepressant. Many people experience some side effects to begin with, but these usually lessen after a week or two. There are other ways to treat depression that don't involve taking drugs. These include talking therapies such as counselling, reminiscence activities, and life story work. Other simple things that can help with depression and anxiety include keeping active, doing activities that you enjoy, and talking to friends and family. Eating a healthy diet and not having too much alcohol or caffeine can also help. To find out more about treatments for dementia, visit alzheimers.org.uk/treatment.
We live for today, don't we? And
Yes.
enjoy it. And enjoy it.
If life is still interesting, then the problem becomes diminished a bit.
It's about stimulation, it's about people doing what they've always done, maybe at a different level to what they've done it, but actually still taking part, seeing their friends, going out and about, and following the interests they've always had. They won't have the same enthusiasms, but none of us do as we get older anyway. So, but it's just managing it and keeping up to date, not letting a person drop out.
Living with dementia is challenging, and you may feel angry or frustrated about what's happening to you. Your plans for the future might change, but dementia doesn't change who you are as a person. A diagnosis doesn't mean that you need to stop doing the things that you enjoy, but you might have to do them in a different way. It's important to focus on the things you can and want to do and try not to allow yourself to become isolated. Keeping busy with activities you enjoy may help you to feel more confident. Memory problems can be distressing, and it may affect your confidence. There are several things you could try. Try keeping a notebook or a large week-to-view diary. Write down in it things you want to remember, like names or to-do lists. Keep it by the kettle or phone, somewhere you gravitate towards, so you get used to referring to it. There are some technological aids that people can find useful. These include calendar clocks which show the date and the day of the week. Keeping one of these clocks next to the diary or weekly planner can help you orientate yourself when checking appointments. If you find you forget where things are, try putting labels or pictures on cupboards or drawers. This could help remind you what they are. Or you could try keeping some things from the kitchen that you use most often, like a cup, a plate and a set of cutlery, out on a table visually. You could also ask your pharmacist about putting your pills into a disposable box called a dosette box, which has the days of the week marked. Locator devices can also be useful. With these, you attach a small electronic tag to things you often mislay, like keys. You can then click a button on a locator device to make the tag beep. Having dementia can make accidents at home more likely. There are a few ideas you could consider to help you stay safe. You could help prevent falls by making sure the house is well lit and removing any trip hazards like rugs. You could have handrails fitted on the stairs or in the bathroom. Try using a personal alarm so you can alert people if you fall. It's always a good idea to install carbon monoxide detectors and smoke alarms in the home. Try using timers for your plugs, lights and heating systems to turn things on and off automatically. You could ask your local fire service about a free home safety visit to make sure your home is as safe as it can be. An occupational therapist can give advice on items that could improve your safety and help you stay independent. You can ask your GP or memory clinic to refer you to one. There can be lots of benefits to keeping as active as possible, physically, mentally and socially. It's great to meet people. It can help you keep your skills and memory, boost your self-esteem, improve sleep and avoid depression. Activities and occupation are important and make us who we are. We're all unique in what we enjoy. Some things may become more difficult and it may be tempting to give up. However, there are often ways around things. Activities such as painting, cooking, cards and puzzles, woodwork and many others can be adapted or carried out slightly differently. Carry on seeing family and friends and try to have some fun. Try taking regular physical exercise if you can. This can include things like walking and even gardening. Staying physically healthy is also really important for people with dementia. Having dementia doesn't mean you should feel ill, depressed or anxious. So it's important that you check with the doctor if you are feeling unwell, because other illnesses and infections can make you more confused and forgetful. There are some things you can do to help with your general health. Try to eat balanced meals and drink plenty of fluids. Take regular physical exercise if you can and get enough sleep. If you smoke, have a think about stopping. Have the flu vaccine each year, and if you're over 65, you can also ask your GP about the pneumonia vaccine. Have regular checkups with the GP and also have regular sight, hearing and dental checkups. If you find yourself regularly feeling low, anxious or irritable, you may be depressed. This can be treated, so talk to someone close to you about it. Do see your GP if it continues or get worse.
We live a perfectly normal life. We see friends and family, and we go out to meals at restaurants, and we entertain people and go and be entertained by other people. So we live a perfectly normal life.
To find out more about living well with dementia, visit alzheimers.org.uk/livingwell.
I think we've pretty much taken care of the business side of things. It's really when do I stop working, and I mean I want us to have some good times together while we still can. Well, we will.
Very positive about the future, because I think I know where to go for help now, because I've listened to what they've said. I understand what's happening. I understand why things happen. I understand that it's a progressive but slowly progressive disease, so it's not going to happen overnight, and it's going to be slow, and we've got lots of life in front of us before it gets really bad. And I'm very positive about the future.
There are lots of things you can do to make sure you get to choose how you live now and in the future. Where possible, make plans as early as you can with a trusted friend, family member or professional. It may get more difficult for you to make decisions or choices about financial or legal matters as time goes on. Talk to your bank about what they can do to help. This might include arranging what's called a third-party mandate. This allows someone else to deal with your account. Consider setting up direct debits for regular payments such as gas and electricity bills, if you haven't done that already. If you find it difficult to remember PINs for debit or credit cards, the bank can provide alternatives, such as a chip and signature card. It's also important to make sure that all your essential documents can be found easily. This includes bank accounts, mortgage or rent documents, insurance policies, your will, tax, benefits and pension details. People with dementia and their carers may be entitled to a range of benefits. Some are means tested, which means that they depend on your income or savings. Accessing them can seem complicated, but there are people out there who can advise you on what to claim for and help you complete the claim forms, which can seem long and detailed. Help may be available from a social worker, a local welfare rights service, a Citizens Advice Bureau or Age UK, as well as the Department for Social Development if you're in Northern Ireland. The gov.uk website also provides useful information. For some benefits, the Department for Work and Pensions can arrange for someone to visit you at home.
If you are able to, it will help to make decisions and plans so that your future care and finances are handled in a way that reflects your wishes. It's important to have an up-to-date will, as this allows you to choose who inherits your money and possessions. People with dementia can still make or change a will, as long as they understand the decision they're making and the implications of any changes. It may be helpful to talk to a solicitor for advice. Another way to help ensure your wishes are carried out is to consider giving someone you trust a power of attorney. This means that the attorney, often a spouse or adult son or daughter, can make certain decisions on your behalf if you lose the ability to do this. The legal document to set this up in England and Wales is called a lasting power of attorney, or LPA. There are two types of LPA. One is for health and welfare, for decisions about medical treatment, for example, and the other is for property and affairs, which gives the attorney power over things like bank accounts, bills, or selling the house. In Northern Ireland, the law is different. To give someone power of attorney in Northern Ireland, you will need to make an enduring power of attorney, or EPA. You can choose to make decisions about your future care in a range of other ways too. Discussing views and preferences with family and health or social care professionals is called advanced care planning. Advanced care planning includes one or more of the following: putting in place a lasting power of attorney, if you're in England and Wales, or an enduring power of attorney in Northern Ireland, which I've just talked about. Making an advanced statement, where you can write down your priorities and preferences for the future. Making an advanced decision, if you are in England and Wales, or an advanced directive in Northern Ireland. This is a legal document that allows you to refuse, in advance, specific medical treatments or procedures, in case you become unable to decide for yourself. You may, for example, choose not to have your heart or breathing restarted if they stop. Discussions about care at the end of life can be very difficult for everyone involved. There shouldn't be any pressure on you to have these discussions. However, if you are thinking about advanced care planning, it's important not to leave it too late. Having a diagnosis of dementia doesn't necessarily mean you have to stop driving straight away. But if you have a driving licence, the law says you must inform the Driver and Vehicle Licensing Agency, the DVLA, in Great Britain, or the Driver and Vehicle Licensing Northern Ireland, DVLNI, promptly about your diagnosis. You must also tell your car insurance company. The DVLA or DVLNI will request a report from your doctor and might also ask you to take a driving assessment. They will use these to decide whether you can continue to drive. Many people with dementia choose to stop driving voluntarily. It's best to stop if you feel less confident or become confused, even on familiar routes. As dementia progresses, there will be a time when stopping driving becomes essential. Stopping driving can be difficult to adjust to, but there can be some benefits. You might feel less stressed, and you'll save money on car insurance and fuel costs. Taking control of alternative travel options, such as getting a free bus pass, can help you with the transition, as can talking through how you feel with family and friends. It is possible to continue working after a diagnosis of dementia. Some people find working helps them to feel better physically and emotionally. Others might feel that it is the best thing to do to stop. In some jobs, you are legally obliged to tell your employer about your diagnosis, so you'll need to check your contract. If you drive as part of your job, you should let your employer know straight away. You might feel anxious about telling your employer about your diagnosis, but doing so will help to give you protection under the law. Once your employer knows, they must try to make reasonable adjustments so you can keep working if you are able.
My boss was very understanding. He's basically said, tell me what you can do, tell me what you can't do, and we'll see what we can do to make the job work for you. The understanding of my colleagues has been incredibly helpful. It's just made such a difference because it's out in the open and we can discuss any problems we've got.
You also might be eligible for a range of benefits. Depending on individual circumstances, these can include things like personal independence payment, statutory sick pay, employment and support allowance, housing benefit and council tax support. For people with dementia who are of working age, and maybe for their carers too, some benefits are changing. The new universal credit will replace several means-tested benefits, including income support, income-related employment and support allowance, and housing benefit. For more information about universal credit and how it will affect you, talk to a Welfare Rights Service or Citizens Advice Bureau. To find out more about planning ahead, visit alzheimers.org.uk/planningahead.
We meet and we talk about it, and I suppose that itself is an advantage.
They take the mickey out of each other and they crack jokes, and they're just so relaxed and comfortable with it.
Yeah, I had great trouble getting him out to start with. He wouldn't go anywhere, but now that he's joined all these different things, he has this support worker from the Alzheimer's in Salisbury, and she's very good. She comes along once a week and she'll get him to go out. You know, she takes him out to places and they'll go and have a coffee in the garden centre or something. So he gets more of an active life now than he was having.
A diagnosis of dementia can be daunting and raises many questions about the future. Asking for help can feel difficult, particularly if you've always been independent. You might not feel you need it straight away, but it can be useful to know that a wide range of information and support is available to help you live well and stay independent for as long as possible. The main sources of information and support are the NHS, social services, private companies and charities, and not-for-profit organisations. To find services in your area, start by contacting your local memory service or social services department, GP, Alzheimer's Society or Citizens Advice Bureau. Organisations such as Alzheimer's Society can support people with dementia, their families and carers in a range of ways. These include dementia support workers and support groups, telephone helplines and information materials. Lots of different healthcare professionals can support you too, such as community nurses, dietitians and occupational therapists who help people maintain everyday skills. Social care professionals such as social workers and home carers can also offer advice. If you need support at home, the first step is to ask social services for a community care assessment, sometimes called a care assessment or needs assessment. This aims to find ways to help you maintain your independence and quality of life, and will involve a discussion between you and someone from social services. You might also be asked to fill in a questionnaire, which they can help you with if you need them to. To arrange a community care assessment, you or a relative or friend can contact social services directly. Alternatively, a GP, consultant or other professional involved in your care can make a referral. Assessment, information and advice are always free. Social services will appoint someone, usually a social worker, to be responsible for planning your care and support. He or she will draw up a written care and support plan that looks at how they can meet your needs. They may charge you for some services, or they may cover the costs, possibly in the form of a personal budget or direct payment. This is money from the local authority that you use to pay for your care and support. If you have been diagnosed with dementia and are in your 40s, 50s or early 60s, you will have very different interests, care and support needs from someone diagnosed in their 80s or 90s. For example, younger people are more likely to be working or have a partner who is, or have dependent children or possibly dependent parents and still have a mortgage. The number of services suitable for younger people is growing, but progress is slow and services may not be available in your local area. Ask your memory clinic, your consultant, GP or local social services about support and services for younger people with dementia. Contact Alzheimer's Society about putting you, your family or carers in contact with others in your local area or in similar circumstances. Alzheimer's Society online discussion, Talking Point, includes a section for younger people with dementia and their carers, which might also be useful. You might also find it helpful to visit websites and subscribe to newsletters that support people with a particular type of dementia. To find out more about services for people with dementia, visit alzheimers.org.uk/support services. Caring for and supporting someone with dementia can be stressful and at times upsetting. It can also be very rewarding. It is important that you look after your own health and well-being and turn to others for support when you need it.
Alzheimer's had a fantastic course for carers, which I did almost immediately after he was diagnosed. And they did one on finance and one on legal stuff, and then they had all sorts of different subjects. That was brilliant because they taught you a lot, but you could also ask questions. They also had a legal advisor come along and talk to you, and a financial person come along. Any questions that you had were answered there, and if you didn't have a question at the time, you could always go in a few weeks later and they'd find out for you. So it was absolutely brilliant.
Everyone is different, but you might find yourself experiencing a range of emotions at different times. Try and take time to reflect on how you're feeling and talk to someone you trust. You might choose a professional, a friend or family member, or someone at a carer support group. If you use the internet, you could try an online discussion and support forum like Talking Point. Getting support will make it easier for you to cope and better for the person you care for. Sources of support for carers include family and friends, health and social care professionals, memory services, carer support groups, and organisations such as Alzheimer's Society. Looking after your own health and well-being is vital when you're a carer. It is important to make sure that you eat a balanced diet and make time for regular exercise and physical activity. Even going for a walk can help. Make sure you see your GP about your own health on a regular basis. If you're having problems sleeping, ask them for advice. If you feel sad or anxious a lot of the time, talk to them about it as early as possible, as these could be signs of depression. Try to make sure you have some regular time to relax or do something just for yourself. This can have a big impact on your well-being. Try to get out regularly to meet friends. If possible, consider an outing or short break, which can relieve stress and leave you feeling refreshed. Find out about daycare or respite support for the person you care for, so that you can take time out knowing they are well looked after.
But to help anybody with any problem, you've got to realise what they are like as people, haven't you? So one line of help will be more beneficial, say, to you than it would for anybody else.
Much of how you care for the person will come naturally. You will probably know the person the best, and you shouldn't underestimate the value you can bring to their care. It is important to continue to see the person and not just their dementia. When you help out, focus on what they can do rather than on what they can't. For example, lay clothes out for someone to dress themselves, which will help to promote their independence. They may find it hard to remember or concentrate on things, so try to be flexible, tolerant and patient. Allow extra time to do things. Put yourself in their shoes. Try to understand how they might be feeling and how they might want to be cared for. Include them in conversations and activities as much as possible, and make sure they have meaningful things to do, from everyday chores to leisure activities or socialising. Find things to do together if you can. Dementia will affect a person's ability to communicate. In most types of dementia, people will at times struggle to find the right words or follow a conversation. This can be upsetting and frustrating for both you as a carer and the person with dementia. Ensure that you make eye contact and listen as carefully as you can. Notice your body language and think about how you use gestures, facial expressions and touch. Try to speak clearly, and if you aren't being understood, use simpler words or explain things differently. Bear in mind that other things, and not just dementia, can affect communication, like hearing or eyesight problems, pain or side effects of medication. If it feels right, it can sometimes help to deal with misunderstandings and mistakes using humour, but you will need to judge how the person responds to this. At times, people with dementia behave differently from how they used to. Some behaviours can be particularly unusual or challenging. Behaviours which might seem unusual include asking the same question or repeating an action over and over, restlessness like pacing or fidgeting, lack of inhibition such as socially inappropriate behaviour in public, and thinking someone has taken something belonging to them when they've actually mislaid it. More challenging behaviours include the person becoming very agitated or shouting out, perhaps in a response to a hallucination. The person may also be physically or verbally aggressive. While it can be very difficult, it's best to deal with any potentially tense situations as calmly as you can. Keep in mind that even where behaviour appears to be targeted at you, this may be just because you are there. Symptoms might be caused by a curable health problem, such as pain or discomfort due to constipation or an infection. See your GP if you suspect this might be the cause. Sometimes the behaviour is really the person trying to communicate an unmet need, for example, that they are bored or frustrated. If problematic behaviour persists or causes distress, seek advice and support from your GP, memory service, community mental health nurse, or Admiral nurse, who are mental health nurses who specialise in dementia. If the behaviour persists and you're not in contact with a dementia specialist, ask for a referral. Sometimes the doctor might suggest medication. This may be one of the drugs mentioned in the treatments film. If these do not help, your doctor may recommend an antipsychotic drug. If so, talk to the doctor about the benefits and risks. These drugs don't work for everyone and can have serious side effects. To find out more about support for carers, visit alzheimers.org.uk/carers. Alzheimer's Society is the UK's leading support and research charity for people with dementia, their families and carers. We provide a range of services and resources to support people affected by dementia. We have national services that are available wherever you live in England, Wales and Northern Ireland. These include the National Dementia Helpline, Talking Point, an online discussion forum, and our range of information resources for people affected by dementia, as well as health and social care professionals. We also offer services locally. These vary depending on where you live and where funding is available. Services include dementia advisors, dementia support workers, dementia cafes, singing for the brain activities, support groups for people with dementia, and support groups for carers. Also available are advocacy services, daycare and home care, and the Carer Information and Support Programme. To find out more about our services, please phone the National Dementia Helpline on 0300 222 1122 or visit alzheimers.org.uk.
Next Steps Checklist. This is a list of things you can do after a diagnosis of dementia that will help you to live well now and make plans for the future. Understand more about your diagnosis. For example, the type of dementia you have and what your drugs are for, if prescribed. Talk to others about how you're feeling and ask your GP if there are any therapies or activities that could help you. Try some methods to help you cope with memory loss. Introduce exercise to your daily routine and review your diet to make sure it's balanced. Organise regular checkups with your GP, dentist, optician and chiropodist. Arrange a benefits check for you and your carer. Write or update your will and appoint an attorney. Tell the DVLA or DVLNI and your car insurer about your diagnosis. If driving, ask social services for a community care assessment and a carer's assessment. Get in touch with Alzheimer's Society to find out about local services for you and your carer. To find out more about the Dementia Guide, visit alzheimers.org.uk/Dementia Guide. Useful organisations. Alzheimer's Society National Dementia Helpline. Telephone 0300 222 1122 or email helpline@alzheimers.org.uk. Talking Point online discussion forum. Visit alzheimers.org.uk/Talking Point. Citizens Advice Bureau, CAB. Visit www.citizensadvice.org.uk or www.adviceguide.org.uk. Department for Work and Pensions. Visit www.dwp.gov.uk/local office or www.gov.uk. NHS Choices. Visit www.nhs.uk. Office of Public Guardian and Court of Protection. Telephone 0300 456 0300 or email customerservices@publicguardian.gsi.gov.uk or visit www.gov.uk/office-of-public-guardian. Solicitors for the Elderly. Telephone 0844 567 6173 for help finding a solicitor or email admin@solicitorsfortheelderly.com or visit www.solicitorsfortheelderly.com/public/search. To find out more about useful organisations, visit alzheimers.org.uk/Dementia Guide.